It's interesting you're saying that because Dr. Schaffner and I were having a conversation just before we went live about how some men who have these long histories of outlet obstructive symptoms from a benign enlarged prostate, then all of a sudden get diagnosed with prostate cancer. And then when they have that prostate treated at that point, then they develop all the secondary side effects of urinary urgency and urgent continence, or sometimes even progressive stress incontinence because their bladder now is hyperactive or overactive. And that's because of all the years of trying to outwit the prostate that they've been suffering from. Do you have any discussions that you have with patients, and how do you apply, like, say, the AUA symptom score or IPSS before you go ahead and do these things?
Yeah, so I absolutely review. I mean, I'm glad you brought that up because the AUA symptom score, also kind of synonymous with IPSS, is a series of questions that ask men about their voiding symptoms, and in general, they can kind of be divided into storage symptoms. They can be divided into obstructive or emptying symptoms, and so it's important to really kind of flesh out with the men where their symptoms lie and what's really causing the issue. So when do they experience, excuse me, when do they experience incontinence? Is it around the clock? Is it daytime only? Is it nighttime only? Is it, with that physical activity, or is it when they're just sitting on the couch watching TV, not really being physically active? In some cases, it's not so clear. And then additional testing, such as urodynamics, cystoscopy, voiding diaries, which we sometimes ask them to take at home, to actually objectively keep track of what they're drinking and how often they're using the bathroom and leaking, can help differentiate the two of them.
To try and continue